Hey guys, it's me. I'm just here for my 3-week post-op vertical sleeve gastrectomy update. I'm gonna try and make this kind of a short video because I'm not feeling so super awesome today. I didn't get much sleep last night. First I'm gonna get the numbers out of the way, and then I'm gonna talk about why I didn't sleep so well last night. So since the surgery, or I should say since last week, I lost 2 pounds. Not a big number, but considering what I've lost in total in the last few weeks, I'm okay with it. Like I said, 2 pounds since last week's update. Since the surgery, I have lost 22.5 pounds. Since the week before surgery, I've lost 32.5 pounds. That's okay with me. That's kind of a good number. So that's that for now. I'm still having a really difficult time with food. Really can't eat very much at all. I guess the number's not so big loss-wise, but I can feel it in different parts of my body where the weight's going away and stuff. So as long as the scale's moving in the downward direction, it's okay. Oh yeah, sorry if you hear some noise outside. I've got my door open because it's a really nice day out and I want to get some fresh air. Okay, now to the reason why I'm not feeling so super awesome. I don't want to call this a surgical complication because it doesn't have anything to do with my particular surgery. I guess this can happen to anybody. Could happen to anybody who has any surgery where they have to lay on the operating table. As I've mentioned in several of my videos before, I have edema in my legs and my feet. Not so bad in my feet anymore, but in this past maybe 6 months, I've had more of a problem in my my upper top right thigh. And while I was in the hospital, I was unable to take my medication for the edema, and so it kind of swelled up while I was in the hospital, and they couldn't do anything about it because they didn't want me to get dehydrated, because it makes you get rid of the water, the excess water, and I really didn't have so much water in my body to spare, so I couldn't do that. And I've had bouts with it since surgery. Like, I'm a little bit afraid to take the diuretic to get the water out because it leaves me feeling a little bit dehydrated and a little weaker than I already need to, and I'm already feeling weak because of the surgery. I'm still healing. So anyways, not to be too long-winded here, I didn't take the medicine in the hospital, so like the day after my surgery, I noticed that the top part of my leg was numb, and I told them about it, and they said it's okay, like it'll be fine, it'll work itself out. And I was like, okay. So when I came home from the hospital the next day, I went to visit my doctor, and he said that there's a nerve that runs through from the top of your thigh down to like your knee, and it's only in one little portion of my leg that I'm having this sensation, and it will start with, like, I mean, it's numb all the time right now in that area, and I'm on top of it. I'm seeing a doctor and everything, so don't worry, we'll be okay, I'm pretty sure. So it starts off numb in that area, and then it gets like, you know, like when you sit on your leg, like, and your foot falls asleep or whatever, then it goes to that tingly pins and needles feeling, and then it burns a little bit. It's nothing intolerable, but I don't like it. It's uncomfortable. So I already mentioned it to the doctor a couple of times. He said after surgery that's kind of normal because you lay on this table and your back is in kind of a compromised position and it can compress the nerve. So that's what he was assuming that it was, and still assuming that it is. And so it's been 3 weeks, and I think it's not so normal to have like a numb part of your leg. And last night I woke up 2 times once at like 2 o'clock in the morning, once at 4 o'clock in the morning, with searing, burning pain shooting through my leg. I woke my husband up too. That wasn't so nice for him, but he was really sweet and he was there for me. And then, so I went to the doctor today, and he says that he still thinks it's that. It could take up to 6 months. Awesome, right? 6 months to go away on its own. But he's sending me to a neurologist to make sure that it's not anything more serious. He really still thinks it's this, but he doesn't know why it's shooting down my leg. So I'm going to call. I tried to call today, but they were already closed. I'm going to try to call the neurologist and make an appointment tomorrow for as soon as possible, because maybe they can help. I don't know. Or maybe they can give me some tips. I've been dealing with the edema for a long enough time that I know how to kind of subside the swelling without the medicine a little bit, but I can't really do much against this shooting pain myself, so we'll see what happens there. I guess I'll keep you guys updated. I also had a 3-week post-op blood test done today. They're testing my vitamin levels, and I should hear something back tomorrow. I'm assuming there's something lacking there because I'm feeling kind of, weak. But, that's also kind of normal after surgery, so we'll see. I've been taking lots of naps, haven't been eating very much still, and that's kind of that. I've been walking as much as I can. I should walk just a little bit more. I'm going to work on that still. So that's about that. I probably already went over my time, and I'm going to have to edit some of this out, but I hope you guys are all doing good, and I will see you again soon, probably before my next update, my next post-op update. Well, they're all post-op, whatever. Yeah, I'm tired. Talk to you later. Bye.